These testimonials are representative of my or our experiences, but the exact results and experience will be unique and individual to each person. The information provided herein is not medical advice and is not intended to substitute for the advice of your personal physician or other healthcare providers. Welcome to The Beautiful Bag. This is your host, Leanne Hayden, cancer survivor, and more importantly, ostomy lifer. Each and every week, I'm going to be bringing a special guest or some inspiration for you and a few little stories along the way so that you can learn what life is like for us to be living in an ostomy and why we all think it's a beautiful bag. So listen in and let's get started. Well, hello, everybody, and welcome to this week's The Beautiful Bag podcast. This one is, we're going to try and make it a regular. It's going to be called Ask the Doctor because this week I am, our guest this week is Dr. Ivatury, who was my colorectal surgeon who helped remove the stinking cancer out of my pelvis and told me I was in an ostomy. So the poor guy had to put up with me for a few months prior to the surgery to get me ready for it. But so Dr. Ivatury is the chief of colorectal surgery at Dell Medical School at University of Texas in Austin. So Dr. Ivatury, welcome to the podcast.
It's great to be here, Leanne. You know, we've known each other now for over 6 years, and congratulations on your anniversary from your surgery.
Thank you so much. And, my big thank you to you because I'm only here because of you. Sorry, but it's true. So there is that presence there.
That's very kind of you.
Yeah,
but, I'm glad that it worked out.
Thank you. And I know you told me once that I had kept you up for a few weeks trying to figure out my surgery because I was such a pain in the butt patient, but.
Well, I'm a colorectal surgeon, so pain in the butts are my specialty. So, but yours was a special case, so that's what kept me up.
Well, thank you, and you did a great job. And I am here 6+ years later to talk about it. And but we're not here to talk about me. We're here to answer some people's questions because I have been working with a lot of ostomates around the world. And there's always a few questions that we have. So I figure we can make this, a regular every once in a while, have you come on and answer some of their questions. So we can dig
happy to do that. I hope people will find it useful and beneficial. But I'm glad to be here. Thanks for having me.
Yeah, you're welcome. And thank you for doing this. So one of the big questions that I get, and I think this can lead into other things is, trying when you're in an ostomy, it's difficult to stay hydrated, right? We're dehydrated a lot without even realizing that we are. Can you explain, why that is? And then maybe we can talk about some things that we can do to really help keep us hydrated.
Yeah. People have different types of ostomies. So, and dehydration is a different problem for an ileostomy than it is for a colostomy. Just from an anatomy standpoint, your small intestine or your ileum typically doesn't do a lot of water absorption when you don't have an ostomy. If you have all of your intestines, an ileostomy, the ileum does a lot of nutrition absorption and some water absorption, but a lot of that water absorption happens within your colon. So if you have an ileostomy, either because your colon has been removed, or you have an ileostomy because you have your colon, but for whatever reason you have an ileostomy, your small intestine initially takes some time to adapt to be able to start absorbing water. The ileum in the small intestine has the ability to figure out how to absorb water, but doesn't do it on a regular basis until it kind of recognizes that the colon is not part of the system in which the digestive juices as well as the food that you eat go through. So we typically find that people with new ileostomies end up having about 1 to 2 to 3 month period where they have a higher output. We're really looking for something about 1.5 liters of output or less in a 24-hour period with an ileostomy. That's about 6.5 cups or 50 ounces of fluid out of your ostomy, specifically an ileostomy. Part of those issues are the fact that your small intestine is not absorbing the water until it realizes, again, that the colon is not involved. It's also that it depends on how much small intestine you have. If you have less amount of small intestine, you have kind of less about surface area to kind of absorb things. But for most people who have, just an ileostomy with no or very little small intestine removed, you can live fine with normal levels of hydration, usually about a couple of months after having it. People with colostomy, it's the same sort of thing, except you do have some of that colon, especially the right side of your colon, which does a lot of the water absorption. If you do have the right side of your colon, you may find that out of your colostomy, you have pretty solid stool that comes out like you would have if you were pooping from the bottom. And it's pretty much like the same as if, from a system standpoint. So people with colostomies that have the majority of their colon, that's connected before their ostomy, they end up having the same things that we tell folks. You need to drink 8 to 10 glasses of water a day. Make sure you take a good amount of fiber. Roughage and things like that. Obviously, if it's hotter outside, you may be prone to dehydration. So those are the kind of differences from an ileostomy and colostomy standpoint. And then what I would say is it's really kind of important to continue to just have an eye on how much comes out. When you may find that when you drink liquids out and not eat food, that you'll find that those liquids come out much quicker out of your ileostomy. So for folks, we tell them to take some small meals and drink liquids with their meals, so that the solid food helps sop up some of that liquid and slows the amount of time it goes through the small intestine, so that the small intestine has time to be able to absorb those liquids. And then just like everything else, when it's hot outside, when you're sick, you're going to have to drink more. You're going to have to stay hydrated. And there are oral rehydration solutions that are available. You can just Google oral rehydration solutions. They're also kind of commercial formulations, like things like Pedialyte and things like that have the electrolytes and everything like that in there. So to answer your question, it's different from an ileostomy and a colostomy, but people are people. You're not. It's all the same sort of things that you would with people without an ostomy. You've got to continue to maintain a balance of liquid and solid, and eating solid food and so forth.
You said some things that were very interesting, because I'm like, I had no idea. And I know there's a lot of people that listen that are in ileostomies and they're like, I'm constantly dehydrated. What can I do about that? But, you said something that your small intestine, how smart is our body, right? Like, just how incredible is it that your small intestine all of a sudden says, oh, I don't have a colon anymore. Now I have to take on this job as well of absorbing the water. How many I know it's different for everybody, but on average, how long does that process take usually for an ileostomy to understand that its job is changing and it's taking more on?
As you know, it's variable, but typically it's somewhere between like 6 weeks to 3 months after having a new ileostomy that the small intestine starts absorbing liquid better. You'll notice that as someone with an ileostomy, because the output will be a lot less liquid and more thick applesauce or squash-like consistency, which means that a lot more of the liquid is being absorbed. So those are the typical time frame, as long as you have enough small intestine to have enough surface area to be able to absorb things. Some folks need to have more routine infusions of fluids, depending on how much small intestine, the health of their small intestine, et cetera.
Okay. All right. So there's that too. So, they can go in and get their infusions. They can, get hydrated from those and then let the body do the rest of the stuff. So there's some great tips, guys. Have your water with have smaller meals. If you're with an ileostomy, drink your fluids with it. And then the consistency, like you said, was applesauce, like an applesauce kind of a consistency for ileostomies and colostomies. We're luckier, right? So our body can do a lot more of what it normally did. But always remember, you had mentioned 8 to 10 glasses of water, more if you're sweating, probably more if you're working out, things like that. But the minimum is 8 to 10 glasses that you need to have. Did I miss anything, or was did I summarize that?
That was fantastic. That was fantastic. I would add that, it's going to depend on what you eat. You're a human being, you're a social animal. You have, you may be busy with work, you may be busy with many other things. So having things that can thicken things and quickly are things like bananas, white rice, applesauce, toast. Having a banana around may be helpful, just in case, like an emergency banana in case you have a lot of liquid output. You have things like cheese, creamy peanut butter, pasta, mashed potatoes, white bread, marshmallows. Those sort of things will be helpful also from a thickening standpoint if you notice that you're having a little bit more liquid output. And it may be one of those things that you just have a banana in between meals, and that kind of helps sop things up in the interval between your meals and your ability and your time for when you eat food. And obviously, when you eat food, drink the liquids with the food because that is helpful. Like I said, because it helps, the food helps absorb those liquids and reduces the time that it flows quickly into the ostomy, or it increases the time that it stays within the small intestine and helps absorb.
Oh, this is great information. I know everybody's gonna be all over it. So thank you for that. Is there anything else within hydration that you think we should mention?
Some people do things like, so those are the kind of dietary tips. Sometimes you have to use things like Imodium to slow things down. Usually you start with a half a tablet about 30 minutes before meals and at bedtime. And if it helps, but it's not enough, you can go to 1 tablet, 30 meals before meals and bedtime. But that's usually kind of a short-term thing. You may ideally trying to control it within how you eat, that aspect is probably the best way to do it. But sometimes you may find that you are having high output, and Imodium, like a medication like that, helps. Sometimes we use a Metamucil for ileostomies in a very small amount of water, like 4 ounces of water, 2 or 3 times a day, because it's kind of like that fiber that's soluble. It goes in the fluid, but it helps kind of absorb some of that water and slows the transit too. And that's something that we do as well while patients are in the hospital.
Okay, that's awesome. That's awesome. No, these are great tips. So we're gonna switch gears a little bit. It's kind of staying on the same track, because I want to talk next about blockages, because that's another thing that can happen a lot with people. I had a few, and I didn't even know that was what was going on with me until I got called into a CT scan when I was living in New York City. I was just doing my regular CT scan, and I wasn't feeling good going in. I came home, and the doctor called me. She goes, "How are you feeling?" I go, "Well, I just went into the bathroom and threw up. I was having pain in my stomach." And she goes, "Yeah, you have a blockage. Can you please come to the emergency room?" I mean, you know me. Like, oh, is that what that is? Okay. All right. Let me just go check it out. So I Ubered myself to the hospital because I was in New York. I'm like, how do you get to the hospital? Call an Uber. So I got there, an NG tube and all of that. And what they discovered with me is I have some adhesions that are wrapped around the outsides of my colon, so which can create blockages. So I know, stay away from kale salads, because now that frightens me. Because that's what I had that slowed everything down and got stuck. And then, and now it's just, I eat smaller meals for myself, just to kind of break the fiber down into smaller chunks. to process through, but other people have blockages for all other reasons. So what are some of the things that can cause a blockage? And what are some of the things that people can do to help prevent them?
Yeah, so this is a great kind of story, because it talks about many different aspects of possible blockages. You know, if you think of the intestines as a pipe, and so you can have blockages from the inside. That means the pipe is stuck with things like, maybe in your case, it was a lot of kale salad that kind of just all glommed together and became a blockage that eventually passed once it went through. It could be adhesions or scar tissue on the outside that, the intestines move constantly. And if the intestines move in a certain way and they get pinched off, then it's like somebody kind of kinking a pipe, so it has less channel for things to pass. So it could be one or it could be both. Other thing I know that we had talked about, maybe talking about, is also if you have a hernia, if you have something kind of up against your ostomy that's kind of pushing up and against your ostomy, that also could be a reason. Any sort of pressure on the outside or something on the inside. And then some people, with ileostomies that have inflammatory bowel disease like Crohn's disease, those are possible things within the lining that's not food, that's just like rust in the pipe or inflammation or scar tissue that's narrowing the channel. So it could be one of many things. And for a colon, also, we worry sometimes about, a tumor or a polyp, something on the inside causing a blockage. But in a big picture things, it's either something on the inside or something kinking or pinching the bowel on the outside. Surgery makes scar tissue. So the fact that you have scar tissue is my fault. And it is the nature of the situation. A lot of times when we do minimally invasive surgery, like laparoscopic or robotic surgery, that produces less scar tissue. And so, if you've had that, you're probably less prone to get scar tissue. Or if you have an inflammatory bowel disease like Crohn's and ulcerative colitis, and we're on immunosuppressive medication like steroids, many times that the body just doesn't make a lot of scar tissue because the steroids kind of prevent it from doing so. We haven't found a great solution in terms of dealing with scar tissue. There are films and sprays that you can put in the abdomen after you do surgery. And they've been very mixed reviews. So we try to prevent it as just one of those things as surgeons we really haven't fully figured out yet. And I think once we figure that out, it will help people to have partial blockages. So I think if you have, so part of it is, when you have symptoms of a blockage, like you were saying, like nausea, vomiting, feeling bloated, not really putting out from your ileostomy or colostomy, then those are the kind of symptoms that are very suggestive of a blockage. Obviously, in the short run, if you can, especially people with ileostomies in which, you're emptying the bag somewhere between 2 to 3 to 4 to 6 times a day, you should be having kind of routine output out of your ileostomy. If you're not, in the short run, if you can take things orally, warm fluids can help. If it's something inside that's food related that I had a patient that had a lot of carrots once, and the carrots just kind of gummed up right at the area of the ileostomy. Or sweet corn was another one of those things that I've taken care of people that have had an ostomy blockage related to that. Usually kind of warm fluids and time, the body ends up getting all of that kind of food debris and food stuffs out. If for patients with colostomies, if you're passing gas, but you're not putting out stool, you're probably just constipated, meaning that you may be dehydrated, your stool may be hard, you may want to take something that you would take for constipation, like a Miralax or prune juice or something like that, just to get things passing. And so if you have some sort of story, where I ate this, probably shouldn't have eaten as much of that. It's probably something on the inside. But, if it could be something on the outside, but if you're, nausea, vomiting, if you're not feeling well, you're not putting out of your ostomy, that's a time that you really should consider going to your primary care doctor, your colorectal surgeon, your gastroenterologist, or the emergency department to get evaluated. Most of the time, blockages related to scar tissue actually get better without surgery. They put an NG tube in, which you mentioned it, it's a tube that goes from the nose to help suck out your stomach. It basically takes everything out so that your intestines aren't just constantly getting filled with digestive juices, because your intestines keep putting out digestive juices whether you have a blockage or not. So that's the NG tube helps kind of decompress and suck out a lot of the stuff that's in there. And then, people do imaging with CT scans or X-rays. And usually with the decompression and time, the scar tissue goes away, doesn't go away, but the blockage related to scar tissue, the intestines end up moving and get itself unkinked. There's been new studies that have talked about, you may notice if you have had this situation, sometimes the doctors will put a little some of that oral contrast, the same stuff that you would drink for a CT scan, through an NG tube, and take an X-ray, because we want to see whether that contrast gets into the colon or not. And that has been a new thing to determine whether patients need to have surgery or not. Okay. And so there's a lot of decision making. It'll be between obviously your specific situation and your doctor, but for you at home, it's if you're putting out gas but not a lot of liquid, especially with a colostomy, you're probably just constipated. And folks with an ileostomy, you should be putting out fairly regularly. If you notice that it's getting less, and you've eaten something that you don't normally eat, or something that has potentially a little bit more fibrous stuff, you may want some warm fluids, hot compresses, just to get the things out of the intestine. And usually you go back to your normal state.
That's great. And you just mentioned something, and it just triggered. Somebody had asked me a question. You said hot compresses. Somebody had cramps. And this is just another question, but it makes me think of it. And she didn't know if it was okay to put like a heating pad or a hot compress on the, around or on her ostomy bag. Like, is that, she was like, is that okay for me to do?
Usually you don't want it kind of directly onto the tissue, but if you have a cloth or a towel and you put a heating pad on top of it, that's probably that should be fine. Obviously, we don't want to have extreme temperatures right onto that, the lining of your small intestine or your colon, but the heat will still go through a towel and things like that. And the heating pad relaxes your abdominal muscles, and then also just helps break up some of the things within your intestines as your intestines are trying to push out things. And people with blockages, sometimes you'll hear your intestines really loudly because they're trying to go against a blockage. It's kind of like going against the closed door. You're banging against the door trying to get things through. And so you may notice that as one of your first symptoms.
Oh, that's great. Now, some of the myths, or I don't know if they're myths or if they really work or whatever, so I'm putting them in quotes here in my hands, but some people have said having Coca-Cola for some reason helps with blockages, like having a bottle of Coca-Cola or a glass of Coke will help. There's something in it that helps break it out. Now, I mean, it takes rust off cars. so there's that. But what are is
that what gives it the caramel color of Coca-Cola?
Something like that. But people have sworn by it. Having a glass of Coke sometimes helps break down those blockages.
Yeah, absolutely. That's good. It's a carbonation. We do that sometimes for people who have feeding tubes too that get blocked. Sometimes you put in some Coca-Cola. It's the carbonation, it's the bubbliness that helps kind of move things around and break things up. So that certainly can help if you can take it. Sometimes when you have a real blockage, it's really hard to take anything orally. You feel really nauseated and things like that. But if you're feeling something starting, that's why the warm liquids, fizzy liquids, all that stuff is helpful.
Oh, that's great. That's great. And then, like I said, for myself, I've learned, I like eating smaller meals anyways throughout the day. It works for me. And then it could be just more of a mental thing, or it's that physical thing now. And then taking in, having your fiber and monitoring your fiber too. So, on that note, is there anything else on either subject that you can think of that we talked about? Because I know we're going to do this much more, a lot more, and I want to get into conversations like hernias and dealing with hernias and working out and things like that. But is there anything else on these two topics, hydration and blockages?
I mean, I think the major thing that we see, the people that manage it the best are the ones that pay attention to their body. So it doesn't matter if you have an ostomy or don't have an ostomy, but especially if you have an ostomy, you have some way to kind of know how your body feels, and you have a physical way to see how much is coming out of your ostomy. Like you said, you don't want to eat a kale salad. For me, I feel like for you, if you wanted to have a little bit and try it out and have it cut up, you could resume that again. It makes complete sense when people say, I tried this, it didn't work, and I don't ever want to do it again. And it's just a personal choice. Mm-hmm. So I think all of kind of the advice that I would give is just to be conscious of what your body is feeling. And because a lot of things like dehydration, you can prevent it if you figure it out early and say, oh, you know what, I'm having a lot of liquid output today. Let me have some of those things that help thicken my output out of my ileostomy. Or I'm feeling, a little bloated, maybe a little nauseated. I shouldn't have eaten whatever. So you may want to try some fizzy liquids. You may want to try some warm liquids. May want to just give it some time and maybe not eat a whole lot or drink a whole lot, except for those things. But you all know your bodies. So it's really, that's the major advice that I would give.
I love it. And I just want to thank you so much for being here with us this week. And I know I'm going to get a lot of DMs and a lot of messages going, can you ask them next time? So be ready. So we're going to definitely be doing this on the regular.
Oh, it would be my pleasure.
Yeah, it was an honor to have you here today with us.
Great. Thank you so much.
Thank you so much for joining us this week. If you enjoyed this podcast, get the behind the scenes at leannehayden.com/ostomy updates. And also, if you found this episode encouraging, please screenshot it and share it on Instagram. And don't forget to tag me and also the person who was on the episode with me. I occasionally will do special gifts for anyone who does do a screenshot and share it on Instagram or in your stories. Also, lastly, please go to Apple or Google, rate, review, and subscribe to this podcast to keep up with them every single week. I enjoy you guys. Thank you so much for being here.